Hello and welcome to Neurology Made Easy. Today the topic we are going to discuss is very important. It is basically neuropsychological categories of memory. So let's begin. Basically we have short-term memory and long-term memory. So in short term there is immediate recall. Immediate recall is like repetition. Someone says you something and they ask you to repeat and you repeat. This is called immediate recall, or example is the repetition that we do normally daily in our lives. The second thing is working memory. What is working memory? So the example for working memory I will give you that you go to market and you buy some things, and now you're making calculation. Okay, I buy this thing for rupees this or euros this, and this thing for this. So making small calculations that involves your working memory. Another example is that someone tells you a phone number and you move or you go across a room and you go and dial that number. So you kept that number in your mind for some time, like it's brief, short duration, but you remembered it in your mind and then you dialed that number. So, and later on you forget that number. So, this is called working memory, and these are the short term memories. The other thing is long term memory. The long term memory can be explicit or it can be implicit. So, what is explicit and implicit? Explicit means that you are conscious of the event of learning. You are learning new things and you know that the event in which you are learning new things. While in case of implicit memory, you are learning something but you are not conscious of the event of learning. For example, you are learning how to drive a car, but you are not actually concentrating on the event of that learning part. You are concentrating on learning that skill. So there is unconscious, you're unconscious of the event of learning. So this is called implicit memory. Both of these have two parts. The explicit memory is divided into semantic memory. Sorry, I'm writing a little bit slow and small, but I'm also explaining it, so hope you will understand. So semantic memory and episodic memory or comes under the explicit memory, and in the implicit memory we have the procedural memory and visual memory. So the semantic memory is that you know the facts, and for example the shape and color of loin. Someone asks you something and you can understand the meaning, what they are saying. Okay, they are telling you house. Okay, you know what is a house, what we do in the house. So you know the facts that are present. The next thing is episodic memory. Episodic memory is basically the episodes of our life. We got married, I got a child, I got a new car. So these are the episodes of your life, and that involves the episodic memory. Most procedural memory is basically learning how to do something. For example, you are doing you know how to drive a car, you know how to write an email, so you are learning how to do something. Visual memory is basically the memory that involve the visuals representations, so you keep them in mind. So here I have just a recap that memory has short-term memory, long-term memory. In short-term, immediate recall, working memory. In long-term, explicit and implicit. In explicit, we have semantic and episodic memory, and in implicit, we have procedural and visual memory. So now I will tell you that where can be the lesion that can affect these types of memories, because it is very important. If we do not know the area, then it's difficult to like localize the lesion. So in case of immediate recall, we have perisylvian cortex is involved, and mostly in the or in the dominant lobe, in the dominant hemisphere. So in immediate recall, perisylvian cortex involved in the dominant hemisphere. In working memory, we have the prefrontal cortex, thalami, and the medial temporal lobes are involved. Next is the semantic memory. In semantic memory, there is involvement of anterior and inferior temporal and frontal lobes. In episodic memory, there is involvement of association cortex. In visual memory, we there is involvement of occipital lobes, and in procedural memory, there is involvement of premotor and motor cortex, basal ganglia, and cerebellum. So, so that's our important points, that these are the anatomical structures that are involved, and if there is damage to any of these, then you can have these problems. Like the next thing is that the immediate recall is mostly disturbed in case of agitation. Patient is agitated, confused. Like we have a patient in ICU, he has delirium and confusion, so he will not be able to immediately recall things. Then working memory can be affected in Wernicke's encephalitis, Wernicke-Korsakoff syndrome, herpes encephalitis, or damage to the structure that I have mentioned. The next, in case of semantic memory, important cause is frontotemporal dementia, because mainly the frontal and temporal lobes are involved. Again, there can be Alzheimer's disease. So in the long term memory, we have the Alzheimer disease, the degenerative brain disease, chronic conditions that can lead to damage to long term memory. I have already made another video about the amnestic states, that one is sudden, one is subacute, one is chronic, and what are the causes of these. So I hope this video will clear all about these memory, how to divide this memory, and what are the structures involved, and how we can localize the lesion, and will help you in your future. The tests mostly we do are MOCA test and mini mental scoring in our clinics, but there are also a large number of tests that can be used to check a memory of a person. And if you want to use MOCA score in your studies, then you need to take permission from the person who developed the score also, because of copyright issues. But mini mental scoring you can use, I think, without permission. So last but not the least, uh, like the video, subscribe, share, keep smiling, keep sharing the knowledge. And also I would like to hear feedback from you, what in which topics you want to see next videos. Till then, see you.